of urine examination, also known as urine analysis. It is a very important topic in microbiology, and we get routine samples and examination of urine. You can follow me on Insta. My profile is the lab dog 27, and my Facebook page is the lab physician. Please subscribe the channel and press the bell icon for upcoming videos. So let's start our today's topic. So we will cover our today's topic in 5 different headings. First of all, we will understand the composition of normal urine in adults, then the indication of urine examination, collection of urine sample, collection methods, and physical examination of urine. So the composition of normal urine in adults, that is 24 hours. So we have different parameters that we examine in the urine. First of all, the volume. The volume is 600 to 2000 ml. Specific gravity 1.003 to 1.030. Osmolarity 300 to 900 milliosmoles per kg. The pH of normal urine sample is 4.6 to 8. And you can read the following parameters: glucose, proteins, urobilinogen, creatine, uric acid, sodium, potassium, chloride, and etc. Normally, the red cells, epithelial cell, and white blood cells are less than 1 to 2 per eye power filled. So, the indications of urine analysis. First of all, if there is suspected renal disease like glomerulonephritis, nephrotic syndrome, pyelonephritis, and renal failure. Second, detection of urine tract infection, that is UTI. Third is detection and management of metabolic disorders like diabetes mellitus. Fourth, differential diagnosis of jaundice. Fifth, detection and management of plasma cell dyscrasias. And sixth, as you all know, diagnosis of pregnancy. So the collection of urine sample. There are different types of urine sample that can be collected. The most common is first morning midstream sample. It is mainly preferred for routine urine examination. Second one is random midstream. It is also preferred for routine urine examination. Third is first morning midstream clean catch sample, that is for bacteriological examination. There is one postprandial, that is 2 hours after the meal. It is used for estimation of glucose and urobilinogen. Next one is 24-hour urinary sample. It is mainly for quantitative estimation of proteins or hormones. Next is catheterized sample. It is for bacteriological examination in infants, bedridden patients, and obstruction of urinary tract. And the last one is plastic bag. The example, colostomy bag tied around the genitals. It is used in infants and incontinent adults. Now the collection of urine for routine and culture examination. For routine urine analysis, the container is a wide mouth glass bottle of 20 to 30 ml capacity, which is dry, chemically clean, leak proof, and with a tight fitting stopper is used. About 15 ml of midstream sample is cleanly collected in that container. Second one is collection for bacterial culture. For this we use a sterile container, collect midstream clean catch sample, and it must be plated within 2 hours of collection, which it is a very important point, that it must be plated within 2 hours. If it is refrigerated, it must be plated within 24 hours of collection, and no preservatives should be added for bacteriological culture. Now there are different types of collection methods. First of all, it is midstream specimen. This is used for all types of examination. This is after voiding initial half of urine into the toilet, a part of urine is collected in the bottle. Second one is clean catch specimen, and it is recommended for bacteriological culture. In men, the glans penis is sufficiently exposed and cleaned with soap and water. In cases of women, the urethral opening should be exposed, washed with soapy cotton balls, rinsed with water saturated cotton, and holding the labia apart, the initial urine is allowed to pass into the toilet and the remaining is voided into the bottle. The amount can be 20 to 100 ml. The third one is catheter specimen. It is used for bacteriological study or culture in bedridden ill patients or with obstruction of urinary tract. Fourth one is infants. In infants, a clean plastic bag can be attached around the baby's genitalia and left in place for some time. For bacteriological examination, the urine is aspirated from bladder by passing a needle just above symphysis pubis. So I hope you are getting all the points, the different methods of collection of urine. Now let's move to the main topic for today, that is physical examination of urine. As I told you earlier that the urine sample must be tested in laboratory within 2 hours of collection to get the correct results. Otherwise, there is derangement of different parameters if the urine sample is allowed to stand. The physical examination can be done in various headings. First of all, it is volume, odor, color, then specific gravity, then appearance, or the pH. So we will today understand 3-4 topics. Then in the next upcoming videos we will discuss furthermore. So first of all, volume. So as you all know, the volume of 24-hour specimen of urine, it needs to be measured and reported. So the average 24-hour urinary output in adults is 600 to 2000 ml, and the volume varies according to the fluid intake, diet, and the climate changes. Now the abnormalities. First of all, polyuria. When do we say the polyuria? When the volume of urine is more than 2000 ml per 24 hours. Let me take the highlighter. When the urine is more than 2 liter per 24 hours. It can be seen in diabetes mellitus, that is osmotic diuresis, diabetes insipidus due to the failure of secretion of ADH hormone, and in cases of chronic renal failure due to the loss of concentrating ability of kidneys, or if the patient is taking diabetic therapy. Second one is oliguria. Oliguria is called when the volume of urine is less than 400 ml per 24 hours. The causes can be febrile states, acute glomerulonephritis, congestive cardiac failure, or dehydration. And the last one is anuria. Anuria is called when the urinary output is less than 100 ml per 24 hours or complete cessation of urine output. It can occur in cases of acute tubular necrosis, example in shock, hemolytic transfusion, or acute glomerulonephritis and complete urinary tract obstruction. Now, second parameter is color. So the normal urine color is pale yellow to amber, and it is due to the presence of various pigments known as urochrome. If the color is colorless, it is due to overhydration, and if it is dark yellow, it is due to dehydration. So in this table you can see there are various color of urine and condition associated with it. So let's talk one by one. If the color is colorless, it can be dilute due to diabetes mellitus, insipidus, and overhydration. Red can be due to hematuria, hemoglobinuria, porphyria, and myoglobinuria. Dark brown can be due to alkaptonuria. Brown, hemoglobinuria. Yellow, concentrated urine. Yellow green due to biliverdin, and deep yellow with yellow foam due to bilirubin. Orange or orange brown can be due to urobilinogen or porphyrobilinogen. Milky white is seen in chyluria. Red or orange fluorescence, it can be seen in porphyria. Now appearance. The appearance of normal urine is clear in appearance, and if it is foamy, then it can be due to presence of excess proteins or bilirubin. The odor of freshly voided urine is a typical aromatic odor due to volatile organic acids. If it is allowed to stand, the urine develops a ammoniacal odor due to formation of ammonia when urea is decomposed by bacteria. Now, abnormal odor in urine can be, first of all, fruity can be seen in ketoacidosis, starvation, mousy or musty odor in phenylketonuria. If the odor is fishy, it can be UTI with Proteus or tyrosinemia cases. Ammoniacal can be UTI with E. coli or old standing urine. Foul smell due to UTI. Sulfurous odor is due to cystinuria. So I hope these are very important points in the urine examination, and try to remember all these important points. So guys, that's all for today. We will continue our topic of urine analysis in upcoming videos. Up till then, please like, comment, and share, and don't forget to subscribe my channel and press the bell icon so I get motivated for making new videos for you guys. So thank you.